He has been on the job as Metro Health Director for several months now, and we are pleased to have him join us on the KSAT Q&A. Claude Jacob joins us now live. Mr. Jacob, thank you for joining us. What is your message to people? I mean, obviously, you step into a situation where COVID is the issue that you're facing. What are you telling people about where we are right now in this pandemic?
Well, thank you for the opportunity to share our story. So again, bringing you greetings from Metro Health. We remain active on the ground, making sure that we can support residents who are going through this extended experience. It's been a long 18 months for our community. So right now, the main message is to remind folks about the importance of getting vaccinated. You know, really, we have pop-up clinics. We still provide free COVID testing. We are seeing this pandemic amongst the unvaccinated, and that's the pressure that the hospitals are experiencing. Right now, we're following the trends and paying attention to what's happening in the schools. So our take-home message is just to remain vigilant. While the last couple of weeks, we've seen at least an alleviation in terms of our positivity rate, in terms of our case rate per 100,000, but yet we still see the pressures in the hospital. So there's no substitute for protecting oneself by getting vaccinated. We recognize that there's a large subset of the population, especially below the age of 12, that are not yet eligible, but that we're staying on message. Each one here, we're asking folks to do it for themselves, do it for SA, and really to do it for community.
You said it's a pandemic largely of the unvaccinated. I read a story today where they were saying it's also largely uninsured who seem to be hesitant to get the vaccine. What is your message to people who maybe think that they're going to have to pay something for these shots, or there's something that's going to come around to them? I mean, I'm guessing that's why the uninsured are being hesitant about this.
Yeah, again, it would be probably a combination of uninsured or underinsured. And I'll just explain that. Keep in mind, the vaccines are free. The COVID testing is free. And so that should not be a barrier. But what we are hearing are the anecdotes about losing time off of work, or folks are concerned about possible side effects. So we recognize that each individual that chooses to get vaccinated, that they may have a different reaction. But at the end of the day, what we're seeing, especially because of the highly transmissible and highly contagious variant, the Delta variant, that we're reminding folks of the importance of getting vaccinated. And as much as possible, we try to get the word out to tell them that there isn't a cost, but we also understand that they've got to work out their schedules. But at the end of the day, they're better to be protected by being vaccinated.
You're coming to San Antonio from Cambridge, Massachusetts, obviously a much different place than the Alamo City, not just in terms of COVID, but for a lot of different reasons. Is there anything with your experience that you are planning on changing or adjusting when it comes to Metro Health's response and plan of attack against COVID?
Yeah, well, thank you for that. I would just say that we're still building the plane while flying it. And this is across every community across the United States and around the globe. So from Cambridge, I would just say that we've tapped into local assets, local resources, local partners on the ground. And I see the same models already actively in play here in San Antonio and in Bexar County. So for example, our community health workers, our neighborhood ambassadors, our partners with the hospital systems, with the nonprofit organizations, with the faith-based organizations, what it's demonstrating and amplifying, it's the power of the trusted source. It's not just the conversations that one may have with their clinician or their medical provider, but it's also the community partners on the ground who can help try to make sense of this experience. It's been a long 18 months for the community. So I would just say in Cambridge, we work with our neighborhood ambassadors, and I see the same models here in San Antonio. Looks a little different, but it's the same effect, to connect with folks and to help them understand and to get through this COVID experience.
What drew you to San Antonio? I mean, two much different places. Cambridge, Massachusetts, San Antonio, Texas. I mean, I love San Antonio, but you and I were joking off camera about the fact, I told you it does get cooler here eventually. I mean, what was the big attraction to come to Metro Health for you?
Well, we were asking about San Antonio and Metro Health. So, I've been here a few times before for conferences, so I love the Riverwalk. My spouse actually went to graduate school down here many moons ago and always talked about this place. It's a lot sunnier down here in San Antonio, but I got to tell you, the talent at Metro Health, the leadership here in the city, I'm really appreciative and honored to be brought here. But I got to say, at the end of the day, this is an opportunity for us to share a little bit about the unique approaches that we're having here in San Antonio and Bexar County. And plus, this is a larger jurisdiction. So moving from Cambridge, where the population was 120,000 and 6.5 square miles, to a much larger geographic footprint and, 2 million plus population here if you include the county. And so I would just say it's an incredible opportunity. There's a lot of innovation on the ground, and it does my heart good to at least be here to serve.
This is an opportunity for us to introduce you to our viewers, since you are the new director of Metro Health. And I read a really interesting piece in the San Antonio Report last week about why you're in public health. And I always find that so interesting to find out why people do what they do. So can you share that story with us? What led you to where you are now?
Oh, thank you. Again, it was a culmination of different experiences. I grew up in a house full of clinicians. I spent a lot of time doing some volunteer activities. I thought of a clinical career, but opted to go an administrative route. I did have an experience in college where I had a back injury, and it forced me to revisit and reprioritize. But the take-home message was that rather than allow that injury to stop me, I went from being a sprinter to deciding to run distance races. So to date, I've completed 5 full marathons. I stopped doing that many moons ago. That's a young man's sport. But all that to say that it helped me to understand a little bit about the underbelly of our public health system. And I've been doing this for over 20 years, and this is now my 4th state. So I would say that I'm passionate about this work. I've been exposed to community activities from an early age from my parents and my family members. But I have to say, there's a unique environment here. So I'm really pleased and really honored to bring my lens to San Antonio and Bexar County.
Well, I think with that background, it's appropriate that it seems as if you've hit the ground running here in San Antonio. So we appreciate your time.
Well, thank you for this opportunity. Be safe, be well. Take care. And get vaccinated.
Don't forget that. We'll be right back.